Welcome back. Joining us today is Steve Carpenter. He's going to discuss sports injuries, specifically the new laws that are going to be policies on treating athletes who suffer concussions. Boy, this thing has really been in the news a lot in just the last couple of years. So is that the primary thing, football, as far as concussions?
You know, it's the most significant issue because it's potentially to be a permanent issue. You know, when we look at injuries, we deal with orthopedic injuries a lot more often than when we deal with concussion injuries. But concussion injuries obviously have a much bigger catastrophic component to them.
Yeah. What new laws and policies are there to protect children who suffer these injuries?
Recently, both Tennessee and Georgia, both in April of this year, the governors, respective governors, signed into law laws that were based on what's called the Lystat Law. And the Lystat Law is a law out of Washington State that was enacted in 2009 that was named after an individual named Zachary Lystat, who in 2006 had 2 concussions within a game and suffered some permanent injury because of that. The laws that are based on that, there's currently 48 states that have laws or have pending legislation based on the groundbreaking legislation from Washington. That there are components to it dealing with recognition of concussion, signs and symptoms, required release from physicians, one of the most important things is a required graduated return, meaning a child doesn't get released on one day and the next day he's full contact again. It's a gradual progression of activities back to full contact or collision or game play. And those laws are slated both to go into effect January 1 of 2014. Are
you satisfied with them? Is this
absolutely. Absolutely. You know, when you look at these 2 laws, especially in Tennessee and Georgia, they're both based on what the SSAA and the GHSA, what their policies have been over the past couple years. So the laws are not something that's new to the medical community, or at least certain aspects of the medical community, but it's now got some teeth to it. It provides some backbone to the decision-making process.
What are some of the effects of concussions, and can parents and coaches tell if there's something wrong?
There are a lot of signs and symptoms of concussions. You know, headache, dizziness, disorientation, nausea, vomiting, a child not acting like themselves, memory loss. The important thing to remember is that you don't have to have all of those things to have a concussion. You could only have 1 or 2 of those symptoms and actually have just had a concussive event. So it's you know, an observation of a child after an impact or after the injury where they're just not acting like themselves, or they're obviously having some difficulty with normal activities.
Yeah, yeah. How do you treat them?
Rest is the primary way. You know, there's a lot of diagnostic processes that we go through. The actual concussion is diagnosed, you know, more from a process than any one single test. Quite often, especially in significant episodes, a child or an athlete may end up having a CT scan just to make sure there's no bleed.
Yeah.
But the presence of a bleed doesn't determine whether or not they have a concussion. Concussion is diagnosed and treated primarily based on the deficits and the symptoms that occur from that.
Wow, that is most interesting. And folks, if you would like more information, you can go to www.erlanger.org, or you can call 423-778-LINK. And it's something very serious.